Vazyme, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, antigen detection kit, colloidal gold-based. Please read the instructions carefully before test. Kit contents. Open the box. The kit contains these items. Preparation. Wash hands or use hand sanitizer before the operation. Check all components in the test kit are ready for use and within the shelf life. Sample collection and elution. Rinse the mouth with clear water 30 minutes before collection. Carefully remove the seal from the top of elution tube. Avoid spilling. Hold the funnel in one hand and stand upright. Hold the saliva collection tube in the other. Gently spit saliva into the elliptical funnel. The mixture volume should reach 1/2 to 2/3 of the elution tube. Remove the funnel and cover the top of the elution tube. Upside down the elution tube 5 times to mix saliva and sample eluent. Test procedure. Unseal the cassette package and take the test cassette. Place it gently. Place the sampled elution tube upside down above the sample well of the test cassette. Gently squeeze the elution tube. Drop 4 drops, about 80 microliters, into the sample well and start counting. Visually, read the results after 10 minutes. Note, the result is invalid after 15 minutes. Interpretation of test results.